Hi, I'm Dr. Darrell Story. In this video we're going to talk about migraine headaches. Migraine headaches are extremely common. It's one of the most common things that I see as a neurologist. There's about 38 million people in the United States with migraine headaches. That's about 12% of the population. It's a pretty astounding number if you think about it. And migraines are more common in women. About 18% of women have migraine headaches. That's pretty amazing. It's a really common problem and potentially a quite disabling problem. And one issue about migraine headaches is that they're kind of underdiagnosed. A lot of people have headaches that they assume are maybe sinus headaches or just stress headaches. But if you really dig into it, it may actually be migraine headaches that that person is having. And the reason to be sure about the diagnosis is that migraine headaches have a lot of potential treatments. So what is a migraine headache? I sort of boil it down to say that a migraine headache is not just a head pain, it's sort of a sick headache. People with migraine headaches have other symptoms along with the head pain. The head pain itself is usually on one side or the other, but it can be on both sides. It's often in the front, say over the eye or actually in the eye, but it can be in the back as well. The nature of the headache could be throbbing and pulsating, or it could be constant. Basically, any kind of head pain could potentially be a migraine headache. It's usually fairly severe though. People usually talk about at least a moderate level pain. What makes a migraine headache though are the accompanying symptoms. So one of the most common symptoms that people have along with a migraine headache is nausea. They just feel sick to their stomach. That's kind of why I call it sort of a sick headache. People feel a little bit nauseous. Sometimes they even vomit, or even vomit a lot, which is pretty horrible. But this could accompany the migraine headache, along with other symptoms such as sensitivity to light, sensitivity to noises, and intolerance to activity. The classic appearance of a person suffering with a migraine headache is sort of lying down in a dark room with something covering their eyes, just not wanting to move or be exposed to any light. Sometimes people also have a warning before their headache onsets. It's called an aura. And usually that aura is visual. And that can happen in about, say, around 25% of patients with migraine headaches. The aura is usually some spots in the visual field or some distortions or the vision of some jagged lines or blobs of light that move around. And sometimes this will happen in the first, say, 30 to 60 minutes before a headache onsets. When people experience their first aura, they're kind of nervous about it. So once you've recognized a diagnosis of migraine headache, where do you go from there? So when I'm talking to patients who have migraine headaches, I talk about three different elements of migraine management. The first element is to try to understand what might be causing the migraine headache. So a lot of people just have headaches that come on randomly and there's not really any trigger. But if you keep a diary and you kind of look at what you're doing in life, a lot of times there can be a trigger that's identified. It could be a certain food. Classically, people talk about cheese or chocolate. There are certain drinks. Classically, people talk about red wine. It could be changes in weather, which obviously you can't do much about. Often it's hot weather or drops in barometric pressure that might happen right before a rainstorm. It could be any change in routine, such as not getting enough sleep or missing a meal. Or it could be stress, or it could be the letdown phase after going through some stressful incident. Some of these things obviously can't be avoided, but if the person can understand what might cause their headaches, that's the first step in trying to get relief from migraine headaches. Step two is to decide on what's the best treatment once you've started to get a headache. And the key with migraine is to treat it right away. Never wait for it to really sock in, because then it just won't respond to therapy very well. A lot of people do fairly well with over-the-counter medications such as ibuprofen or naproxen or acetaminophen. These things are widely available and safe. And if you can get good traction out of a simple medication like that, in other words, take the medication right away, get good relief within the first hour without that headache coming back, then that could be all that you need to do. But if that's not working, many people require prescription medications. The most common medication used is called sumatriptan, and that is a prescription medication. It's a 100 milligram tablet. It's very safe. It's low on side effects. And just like any other treatment, it needs to be taken right away, right when the headache is recognized. You can take that medicine again 2 hours later if needed, if that headache doesn't go away. The real goal is for that headache to be killed off within an hour or two and not come back within the next 24 hours. That's a real successfully treated headache, and that's very important. Step 3, I talk about for people who have headaches that just aren't that responsive to therapy or that happen really frequently. Most folks may have migraine headaches maybe a couple times a year. When it's more troublesome, maybe once or twice a month. And in that case, we usually don't have to talk about a daily pill to reduce the frequency. But in the unfortunate folks who have headaches once a week, twice a week, or even more, we need to talk about ways to reduce that frequency. And that's when it's important to see a headache specialist, such as a neurologist, to go over these options. The types of medicines used include antidepressant medications, such as the older antidepressants called tricyclics. The most common one used is nortriptyline or amitriptyline. These medications are taken at bedtime, are fairly low on side effects, and can reduce the frequency of migraine headaches. The other type of medicine that we use are anti-seizure medications, and the most common one is called topiramate or Topamax. This is also a medication that can typically be taken once a day, fairly low on side effects, and again can reduce the migraine frequency. The other type that we use less commonly are certain antihypertensive or blood pressure medications, specifically beta blockers, and the most common one used is called propranolol. These I kind of shy away from in younger people who are active, want to exercise, because these medications can prevent the heart rate from going up while you exercise, or it can cause some low blood pressure. But the point is there are a lot of options to treat migraine headaches. It's very important to have a treatment plan, because in some cases migraine headaches can accelerate and get more and more frequent and can become chronic and difficult to treat. So if you have regular headaches that maybe qualify as a sick headache or have some of these other qualities, it's important to see your doctor or a neurologist or a headache specialist to go over your options, because there's a lot of options and you shouldn't have to suffer with migraine headaches. Thanks for watching.